Welcome to Viewpoints. I'm Mike Biasotti, and I'm here today with Judge Leifman of Miami to discuss mental illness and how it affects our Homeland Security mission. Judge, can you tell us how you got started in this endeavor?
You know, I didn't realize that when I became a judge, I was actually becoming the gatekeeper to Florida's largest psychiatric facility, and sadly, that's the Miami-Dade County Jail. And as a result of all the cases that are impacting the criminal justice system, I had to learn what mental illnesses were about, how they impacted the community, and how they're affecting the court system.
So, Judge, how do you tie this into Homeland Security issues?
Well, there's a couple ways. There's the indirect and then there's the direct. On the indirect, there's a huge impact that law enforcement is using so much of their time and resources to deal with this issue. Last year, there were over 2 million incidents of arrests involving people with serious mental illnesses. While the United States has 5% of the world's population, we have 25% of the world's inmates. 1 out of 104 adults, as we sit here today, are behind bars in the United States. 1 out of 33 adults, as we sit here today in the United States, are under some type of correctional supervision. And so the police are using enormous resources to have to deal with this. In my own state, for instance, our police handle more mental health calls than they do for the total number of arrests for robbery, grand theft auto, and burglary combined. And so much of our law enforcement time is spent dealing with people with mental illnesses, which takes them away from helping Homeland Security issues and helping look for, issues involving some type of terrorist threat. And then there is the indirect threat. And while the data shows us that we cannot draw a line from your traditional terrorist that may have a serious mental illnesses, there is more and more research showing us that there is some risk when it comes to lone wolves with serious mental illnesses. People with serious schizophrenia who may be sitting in front of a computer all day, watching ISIS tapes all day. Unfortunately, they may get drawn into this situation. We had a case recently in South Florida where our FBI had 24-hour, 7-day-a-week surveillance on a guy with serious schizophrenia who had gotten into this issue. They didn't want to arrest him because they knew that wasn't going to solve anything, but they wanted to make sure he got mental health treatment. He was posting all kinds of strange and bizarre posts on Facebook, dressed in the gear. He had swords, he had guns, and he was, becoming a serious threat to the community. But at the same time, the FBI didn't really know what to do with him. They did not know how to access our mental health system to be able to get him treated. And so part of what we want to do today is let people know that if they are in the Homeland Security, one of the key elements for them to do is to reach out to their county government to find out who their main mental health provider is. And they need to work with them in this field because as the head of my terrorist task force for the FBI told us, was that most of the new cases that they are seeing in South Florida and around the country are involving people with serious mental illnesses. And they just didn't know how to access the mental health system. And so, when people are doing those kinds of things and they are showing signs of dangerousness, there are laws that we can use to involuntarily hospitalize people to make sure they get treated and they can get past this. The other thing I think people also need to understand is, most people with mental illnesses per se are not dangerous. But when they are showing signs and symptoms, treatment works. And so it's very important that we use the laws that we have on the books to get people the treatment and get them into services. Because recovery rates for people with mental illnesses are actually better than for people with heart disease and diabetes. The key is identifying it, teaching our Homeland Security partners how to recognize people that are showing signs and symptoms of serious mental illnesses, and then how to access treatment. Because it doesn't do us any good if we're going to just take some of those folks that are showing signs and symptoms and maybe watching videos and arresting them. Because if we don't deal with the underlying problem of their serious mental illness, we're not going to solve any issue.
Do you see an issue in stovepiping that our mental health services don't communicate effectively with our emergency services and our hospitals for that matter?
That's a great point. And on top of the stovepiping, because there's no one entity that seems to be responsible for the mental health system. So, when you have no one, responsible for a system, the system doesn't really work very well. And on top of that, the mental health system in this country is painfully fragmented. Even if you didn't have a mental health issue, it is almost impossible for most people to access services. And so what we really need to do is to have a coordinated approach. And so when you have a Homeland Security team that's putting a plan together to deal with these issues, it's equally important for them to work with the mental health provider and the mental health entity to make sure they know how to access those systems. And unfortunately, there's not a silver bullet, there's not a switch we can flip that's going to fix this problem. It really requires each community to develop a coordinated approach, and that makes it more difficult because there are so many different communities out there. But if you're going to do this right, you need to work with those entities to be able to make sure you have a coordinated approach to deal with this issue.
So, from your experience, how would you define serious mental illness for our purposes?
Well, generally it's defined by, in the DSM manual put out by the American Psychiatric Association, about 3% of the American population lives and suffers with a serious mental illness, which is usually what we consider to be the kind of the big three or the big four, which would be schizophrenia, bipolar disorder, and major depression, and often trauma-related issues, PTSD-related issues. And so that's generally the psychiatric definition of a serious mental illness. It's chronic, it involves psychosis, and those are the kinds of illnesses that often we see people getting involved in the criminal justice system with.
So what, as a community, state and local and federal level, do you see as options to try and address this issue?
Well, right now there's actually an initiative going on that I think we can involve ourselves with that would kind of help us do this already. It's called the Stepping Up Initiative. It's an initiative through the American Psychiatric Association, the Council of State Governments, and the National Association of Counties. And they're working already to develop these collaboratives in each county. About 360, 370 counties have passed resolutions representing between a third and a half of our American population, where they're starting to work together to build these collaborations so that they can work better to try to reduce the overrepresentation of people with mental illnesses in the criminal justice system. There's really no reason that our Homeland Security partners can't team up with the Stepping Up initiative. You already have a structure in place in so many communities where they should be part of that initiative so that they are coordinating services. So when our Homeland Security partners do come across someone that may be exhibiting signs and symptoms of serious mental illness and they seem to be listening or getting involved in terrorist type activity, that they know who to contact, that they know how to get the person services, and we can help get the person treated. The reality is that it's a small subset of individuals. It's not everybody with mental illnesses. I mean, we did a study in Miami-Dade County where we actually narrowed down the highest utilizers of criminal justice and mental health services to 97 people. They were primarily men, they primarily had schizophrenia type disorder, they were showing more signs of dangerousness, they had co-occurring disorders, which means they were using substance use, abusing drugs along with their mental illness, and most of them were homeless. And at the same time, though, these 97 people were repeating again and again and again. And my point is, most of the community providers already know who they are. And so the chances are that if they've been identified as being very ill and dealing with Homeland Security, the community mental health system probably knows who they are, which makes it easier for us to be able to apply the law to get the person involuntarily hospitalized if necessary. And then there are other tools that the community should be looking at. There are things like assisted outpatient treatment, which unfortunately not all communities have, but when they do have it, it's another additional tool. And what that does is it allows the courts, when people meet a certain criteria, usually dangerousness, maybe a need for treatment, or self-neglect, where the court can have more supervision to make sure that the person is taking their medication and staying on their medication. And in cases like this, I think it would be very important for us to utilize a tool like that. I mean, we don't want to wait until a horrible incident occurs. And these are proactive type tools and laws that allow us to get to the issue before something horrible happens.
Well, that's interesting. And to your point, just last week, if you saw the article out of San Jose, just down the road here, where they announced that 100% of their police shootings this year, 6 in total, all were 100% involved with mentally ill population. And also what we were talking about was the British article that came out in today's newspaper that said they're experiencing similar situation that the U.S. is experiencing. Although their calls for service dropped 10%, their response to severe mental illness rose by 33%. So if I hear what you're saying correctly, and I would agree, that bringing these groups together when we know who this most vulnerable population is that is in need of help immediately, to have a coordinated meeting to understand between the medical community and the criminal justice community, law enforcement, and those persons involved, to bring that together and have a plan to go forward where we can get help when it's needed before these incidents happen, rather than waiting till after an incident like happen, is what needs to be done.
Absolutely, and I think it also needs to be some expansion of what we call the crisis intervention team policing, that it shouldn't necessarily be just for our street officer, but the FBI agents, officers, law enforcement officers that are involved in Homeland Security should also be trained on how to identify someone that's showing signs and symptoms of having a serious mental illness, how to de-escalate a situation so they don't make it worse, and equally important, where to take them once you've made that identification. And if they haven't made the coordination, if they haven't set up the collaboration that you're talking about, they're not going to know what to do. Mm-hmm. And using the traditional methods of law enforcement for people with serious mental illnesses just doesn't work, because unfortunately, we are still using what I call a criminal justice model, where a population health or a disease model is required to help people get treated. And if we started to shift our thinking, and it's not a matter of becoming softer on crime, it's really a matter of becoming smarter on crime. Because if we can identify people that are sick and getting them into the civil community mental health system, then we keep them from coming into the criminal justice system. We help reduce any risks that may be associated with a lone wolf type situation that they're seeing over in Europe and we're seeing here in this country. And so I think it's critically important that our Homeland Security partners learn how to identify these issues, learn how to work with the right partners, and learn where they need to take people for treatment once they've identified a situation.
So I totally agree with you. I don't know if you've seen the article from Reuters, I believe you have, about it starts off with a shooting in the German mall, but it goes on to list numerous lone wolf attacks who are all seriously untreated mentally ill individuals having no real direct ties to any terrorist group. However, with the ideology that they took up that day, whatever motivated them to do these horrific acts. And they showed a lot in the US of the same thing. Many attacks that are lone wolf attacks with no real ties to terrorism groups, but the press picks up as terrorist attacks.
Right, and we have a tendency in this country to oversimplify issues. And when you do that, you oversimplify solutions which don't work. And so we have to nuance a little bit, we have to be smarter about it, we have to be better educated about it, and that really requires us to learn about these illnesses, learn how to identify them, and how to get people treated. And as I said earlier, treatment works. Mm-hmm. I mean, this isn't where it's a death sentence once you have been diagnosed with a serious mental illness. On the contrary, with good treatments, some people with most severe illnesses can live really healthy lives in recovery. The key is getting them early, getting them identified early, and getting them treated early so there's less brain damage from untreated psychosis. But it's really important, and your point is incredibly well taken. We need to make sure that we get ahead of this problem and not wait for it to occur. And by using a different model and a different approach, we'll be able to do that.
A recent study out is indicating that almost 40% of lone wolf attacks involve persons with untreated severe mental illness. It goes further to say that persons with untreated severe mental illness are 13.5 times more likely to involve in violent terrorist activity than a member of a terrorist group without serious mental illness, or the general public for that matter. That's a pretty staggering percentage. Numbers. Mm-hmm. So along those lines, and to get back to what we can do about it, how much of a problem with the stovepiping do you consider HIPAA to be? The laws that regulate what can be said and what can't be said about a person's mental health, when you're talking about between the mental health community and law enforcement community specifically?
Well, I think there's a lot of misinformation and ignorance when it comes to that, because HIPAA does not apply to law enforcement.
Mm-hmm.
Law enforcement officers can share as much information as they want involving people with mental illnesses. I think unfortunately in this country, people have misunderstood HIPAA. It really was developed to teach us how to share information, and unfortunately it's used not to share information, and it's wrong. And so I think we need to probably take a hard look at those laws, make some adjustments in those laws, but I think where it falls down and maybe fails more is a lack of communication between family members and patients as opposed to law enforcement. But I think we need to do a better job educating our law enforcement on what they can and cannot do with the information, and with providers on what they can and cannot give to law enforcement. But once somebody comes into the criminal justice system and where there's an identification of serious mental illness, it's public information at a certain level.
So would you not agree, I know that you've been working this topic for a long time, as have I, and the most frustrating thing I think from this is that we actually see that there are answers to this that aren't being taken, and steps that could be done to correct a lot of these issues that we're facing now. What's your feelings on that?
Well, I think programs like this, helping to educate the community, there's a lot of stigma around mental illness. Shoot, I remember growing up, people didn't even talk about cancer. And, now it's on a tail of an airplane wing, the symbol. We're not nearly at that point, but that's where we need to go. These are just illnesses like any other illness. And people are overly frightened about it, they're embarrassed about it, there's a lot of stigma about it. And so we have to continue to educate the community. We have to treat this like an illness, not a crime. And I think as our society becomes more sophisticated and better informed, we're going to continue down the path to improve it. But I think the key is to applying, like I said, a population health or a disease model around this illness as opposed to a criminal justice model. And if we start to do that and people see that these are just illnesses and that people can recover very well from these illnesses, they're going to understand that we need to treat it a lot better and a lot differently.
So a group approach, multidisciplinary.
Yes, and I think one of the really great benefits of Homeland Security joining the community initiatives is that it helps educate everybody at the same time, including the community, which reduces stigma, makes it easier for people to want to get treatment and access to care.
Well, I can't thank you enough for your efforts in this area. It's needed nationwide, and thanks for your time for our interview today.
Thank you very much.
You're welcome.